Hi, I'm Jodi Smith,
And I'm Joshua Lemax.
and we're going to talk a little bit about the fuel trial. The results are coming out at American Heart Association scientific sessions, and we're going to talk about why they mean so much to us. So I guess I'll start, give you a little background. Joshua was born in 2003 with double outlet right ventricle, and he's had 3 open heart surgeries. The third one is the Fontan surgery, and this trial is with Fontan patients. And I remember when he was born, they kept saying 3 surgeries, 3 surgeries, 3 surgeries. And I thought, somehow in my mind, I thought, oh, he's going to have these 3 surgeries, and then we're going to be good, and then it's going to be done, and everything's going to be great. And we got through the 3rd surgery, and he was in the hospital about a month, and we got home, and I remember going to the first appointment after that, and it hit me that this isn't fixed, that this is a lifelong condition, and I really had a hard time. I went into pretty severe depression at that point, and I was just hopeful for anything that would help Joshua be healthier longer and something else that would come along. I didn't understand why they couldn't fix this, and I thought, gosh, we need technology, we need devices and medications to come along to fix this. And so that's kind of the background of why when the fuel trial came out, I got really excited about it, because I thought, well, this is something that could make a difference for kids like Joshua. And so we talked it over a long time with Joshua's doctors and Katie Dodds at CHOP at Children's Hospital of Philadelphia. We weighed all the pros and cons and decided that this would be a very good thing for us. You want to talk about a little bit about why you thought it would be a good idea?
So I pretty much just looked at every opportunity to get healthier. I was really afraid of death, and it didn't help that my best friend that had the same heart defect as I passed away in 2016, and since then, and I still am just terrified of dying, and I don't want it to happen, so I pretty much look for every opportunity I can to get healthier, ensure my health, and live the life I should. So when I saw this field trial, I pretty much jumped at it. After we weighed that it would be safe, obviously, but I was very eager to get ready and go on this.
Do you want to talk about some of the tests that you had to go through to do the trial?
Yeah, so I did a lot of blood work, which was really bad for me because I'm very, very paranoid of needles. No, I don't do needles, but I do needles because I do them all the time, which sucks. And then also there's a stress test where I had to go on a bike with only breathing through my mouth and going for as long as possible, and I hated that. It was horrible. I couldn't walk afterwards because I'm kind of if I really try something and really determined to do something, even if I don't need to, I'm going to push myself as hard as possible. So pretty much every time I do those, I just cannot walk, and it sucks.
And he always tries to beat his last time on it, his last score on him and everything. But the good news is he did get through all that. And while it was, momentarily unpleasant, that's how important this trial is to us. I mean, we felt like it was worth it. I asked you many times during it, do you want to stop? Do you want to quit? Is this too much? And he always said no. We always felt it was worth it. It was a temporary discomfort, mostly for him, although it was very stressful for me as well to have him go through that. But we always felt like good was going to come out of this trial, and we wanted to be part of that, and we wanted to help other people have access to it. So we shared the information with as many people as possible and told them to enroll in it and get involved in this trial. And so the results are going to come out at American Heart Association scientific session. So what do you think about that? What do you think they're going to be?
Well, I'm hoping they're positive. There was a time that the medicine wasn't approved yet after the first trial, and back then I was on a swim team, and when I was using it, I kept improving. I kept getting better, and then I went off it for a while, and I didn't think anything would happen. It didn't occur to me that anything would happen, because they said you might be on a placebo or you might be on the real medicine, and we didn't know. So I was like, probably no change. And then about like a week after I was off of it, I kept going on the swim team, obviously, and I was going to practice, and I was going the same distances, and like obviously I can usually like improve, and sometimes I was going more, but the same distances I was actually getting a lot more winded and finding it a lot more difficult to go that far. So I was like, wow, this, it must have been getting off the medicine because nothing else changed in my life. So like going from like improving all the time to getting winded at a decrease and like having less cardio, it was mind blowing to me, honestly. So I'm just really hoping the results are positive and I can get back on this medicine because I really would like that.
So we feel like even if they aren't positive, we've seen a difference for Joshua. Whether it's a placebo effect or not, I don't know, but it doesn't seem like it would be. So we're really hopeful for these results. They come out on November 17th at American Heart Association's scientific sessions. So make sure you find out what they are. We're going to have also a webinar explaining the results. Mended Little Hearts and Pediatric Congenital Heart Association and Sisters by Heart with the Pediatric Heart Network are going to have a webinar explaining those results on November 26th at 11 a.m. Eastern Standard Time. So make sure you tune in and find out what the results are. Thank you guys so much. Have a great day.